Good afternoon, everyone. Assalamu alaikum. Welcome to this very special fire chat that I'll be having today with Hicham Mirghani, who is the Director Corporate Affairs GCC Cluster at Astrazeneca. Hicham, welcome on board, and I look forward to our discussion. AstraZeneca joined the community of Dubai Science Park last year. So it's been exactly a year when we signed the MOU, I believe on the last day of Arab Health, with your intention to move to Dubai Science Park. And since then, the move has been very smooth, and you have also done a very good job in terms of making sure that it's a sustainable move and also adds lots of value to the wider community. As you all know, pharmaceutical industry is a very important industry, and it represents a big part of the community of Dubai Science Park, in addition to other industries like medical device, medical equipment, and other industries like renewable energy. But the pharma industry has always been very close to our hearts, and we play a very active role with different associations, both local and regional. So with that, I want to deep dive into what AstraZeneca is doing specifically in the area of sustainability. And also, I think it's a time to reflect on your journey so far. So it's been 365 days. What are your reflections when it comes to your move to Dubai Science Park?
Good afternoon, everyone, and thanks, Dr. Marwan, for having me with you here. So I still remember almost a year ago, we were here signing a MOU about AstraZeneca moving our offices to Science Park. I know I always say that signing is the easiest part, but executing what you have signed is probably the most difficult. But I think we have moved officially to Dubai Science Park back in June, and that was probably one of the best decisions that we have taken. We are really enjoying the community, where we have more than 400 life science companies, so we really feel being part of this community is also allowing us to drive more collaboration between different entities. And I can tell you that we already have a couple of projects with some of the entities who are also in Dubai Science Park. And we are also expanding, by the way, because we had initially 2 floors, but now we have also added an additional floor because we are receiving a lot of
You're
from
probably
the
the fastest company that has with us.
Which is good.
Less than a year. So
probably soon we're going to have the whole building. Let's see. But now we are also enjoying, like many visitors, our CEO also enjoys this Dubai Science Park community and the offices, so we're extremely happy. But another major reason why we have decided to move to Dubai Science Park, on top of the vibrant environment that you are offering, it is also the first milestone on our sustainability strategy. And probably very few of you are aware, but the healthcare sector, as a whole sector from manufacturing, distribution to the healthcare delivery, is contributing up to 5 to 7% of the overall greenhouse gas emission. It sounds like a small number, but in reality, if the healthcare sector was a country, it would be ranked number 5th as the largest producer of greenhouse gas emission. And that's the whole paradox with the healthcare sector. In one hand, the healthcare sector is here to help patients to live a better and longer life. But in the other hand, whenever a patient gets sick and he goes to the hospital, he's also producing carbon, which will impact the global warming, air pollution, and eventually increase non-communicable disease. So there is a clear correlation between the climate crisis and the health emergency. And that's why for us it's very important as a pharma company to do everything possible for the health of people, society, but also the planet.
Yeah, right. Now, I think when people generally think of pharmaceutical, they there is an image of saving lives, vaccines, everyday medicine. So you don't make that correlation to pharma being the bad guys. If it was the airlines, the car industry, there is this direct connection that people, it's very visible, right? But with the pharma is not. So why is it important so if the public perception is good because you save lives, etc., then why do you think it's important for you to be sustainable?
Look, that's a very good question because, again, I think in the mind of people, airlines produce more carbon than the pharma industry. The reality is totally different. In fact, the healthcare sector as a whole produce more carbon footprint. And in the end, what do we want as a pharma company? We want to make sure that people are living a healthier life. And we have a responsibility towards the planet because we know that if we want to claim that we are doing everything possible for the humanity, we also have to take radical actions towards the environment protection. And that's why it's really important for us to work with our partners to make sure that we are decarbonizing not only our operations, because even if you look at the healthcare sector, there is two major buckets of carbon footprint. Manufacturing, distribution, represent about 50% of the overall greenhouse gas emission, but 50% come also from what we call the healthcare delivery, which is mainly hospitals. So as long as we're not tackling those two critical elements, we won't be able to say that we are doing everything possible to save the humanity.
Yeah, this was my next question to you, is that have you looked at have you fragmented the journey from R&D, manufacturing, distribution, and then delivery? So as you said, 50% is between manufacturing and the delivery of care. Now, the manufacturing is under your control, right? So you can do so many things, and I think there has been so much out there about the good manufacturing practice and the green gas emissions, etc. So we can talk about that. But how about the things that are not under your control? You are not delivering the medicine. You're not a hospital group. You're not, you don't manage patients, right? So what are the things and you can do in the delivery of care?
No, I think that's a very, very important question because, again, when we look at decarbonizing care, as you say, there is areas which are under our control, which is our operation, and I can explain a little bit later what we are doing to decarbonize our operations. But 50% will come from the entire ecosystem. And that's why partnership is critical. Public-private partnership, but also private-private partnership. And we have a couple of examples where we are currently working with private entities, but also with government, on how we can drive together this agenda of decarbonizing the care pathway. And actually, back at COP28, we have published a white paper in partnership with Pure Health on how decarbonizing the patient care pathway could have significant benefits, not only for the patients, but also for the society and the planet. I'll give you a very concrete example. Let's talk about chronic kidney disease. As you know, chronic kidney disease is a complication of diabetes. In general, 1 out of 3 patients will end up with this complication. And CKD is not only very costly for the healthcare system, but it also produces a lot of carbon emission because those patients will require a very specific need. They will need to go to the hospital multiple times in a month to do a dialysis. And with this dialysis, you are consuming energy, you are creating waste, you are creating a lot of carbon footprint. Just to give you an analogy, if you look at the entire CKD population in the UAE, they produce around 20 tons of CO2 every year. This is equivalent that if you have an airplane circling the globe more than 50 times. Just to give you the idea of. So what we are working with our partners is to see how we can slow down the progression of CKD to really detect earlier before the patient gets sick in order to decarbonize the care pathway.
Excellent. Now, I think this, proposes like lots of opportunities for startups. And at Dubai Science Park, we try to encourage lots of startups to be joining the community. We also have different mechanisms of support, whether it's incubation, co-working space, and as you know, digital health has been growing massively. So, do you think, with your ambitions to reduce that carbon footprint when it comes to the delivery of care, digital health might be a key, can play a key role in that?
I mean, absolutely. I think digital health is one of the key enabler agenda. And just to share with you, we had GITEX probably a couple of months ago. We are also, and this is very unusual for pharma company to be part of session at GITEX. But this tells us a lot about how AI will play a critical role on driving this agenda. And we have, again, a lot of examples where, I'll give you a very good example, again, about CKD. Ideally, we would like to screen the entire population to see whether at the of developing kidney disease. But in reality, it is not possible. It will cost too much money for the healthcare system. So what do we do here? We are leveraging AI technology to refine the population based on very specific criteria to tell us exactly who should we screen in priority, who are at a high risk of developing kidney disease. And that's exactly how AI can allow us to drive early action, early diagnostic that will have a positive effect not only on the patient outcome, but also on the economy as well as on the environment. So you can hit 3 birds with only 1 stone.
Yeah, I definitely agree with you. Digital health can really transform the delivery of care. And I think what's happening in genomics, AI, can give us even a deeper knowledge into how should we treat the patients. Let's go back to the manufacturing side, because that is also very important, and the UAE and Dubai specifically has great ambitions to be a hub for manufacturing. What is Astrazeneca doing there?
So for sure, manufacturing is one of our key area because as a company, our main role is to discover and develop new medicines. Globally, we have multiple manufacturing across the globe. We do not have yet in UAE, but we know now the government is also pushing to develop this manufacturing in the healthcare sector. But again, just to give you a concrete example of how we're driving also sustainability in manufacturing. Our company has doubled in size since 2015. So we used to be 40,000 employees. Now we are nearly about 80,000 employees worldwide. At the same time, we have reduced by 60% our carbon footprint. We have reduced by 20% our energy consumption. We have also reduced by 20% our energy use. And we're not stopping here. Our CEO made a clear commitment to make sure that AstraZeneca become net zero at the latest by 2045 across our entire value chain, including manufacturing. And we have invested nearly $2 billion on a couple of initiatives. One of them is we are now, very soon, we'll be launching our next generation of inhalers, which are used for asthma and COPD. And probably you are all aware that if you take any inhalers used in asthma, we are using a propellant which is creating also a carbon footprint. And now, hopefully by 2030, or even before, we'll be launching our new generation of inhalers which are environment friendly. Those are one of the big initiatives. Another one, we have also made a couple of partnerships globally. One of in the US, where we have partnered with biogas, where we also want to move into renewable energy. And this will also, we are transitioning entirely in the US into biogas to also fuel our plant with renewable energy. So, example out of many others on how our manufacturers are also moving to become more eco-friendly.
I mean, we are, very proud of what you guys have done in DSP with the Power of Zero and your big commitment to sustainability, which is very, very visible. So we hope that the rest of the pharmaceutical industry and the wider community will learn from the same.
So about the power of zero, because you were also our partner in this event. Can you please tell us, because we never had the chance to talk about it, what was your impression about this, and what are your expectations from the rest of the life science organization to sustainability?
Good question. I mean, the event, by all means, I think it was very, very successful. It made the noise that it deserves. So, really well done for everyone who was involved. But I think the thing that is most important and that will stay for many years to come is the purpose of your move. You didn't move just to expand. I mean, part of it, but the other reason was to be in a sustainable space and also to have a truly sustainable headquarters or offices. I think that's what's very important, and that resonates really well with us because we have invested in facilities that enables that. So not everyone can do it, for various reasons, but the fact that you put your commitment and made it happen, not just signing, is really what makes us happy. Well, Hicham, thank you so much. This was really excellent, and we look forward to our future collaboration and many, many successful years to come.
Looking forward to it, and maybe in a year from now, we'll have more story to share with our panel. So thank you, Dr. Marwan. Thank you all for your participation, and enjoy the rest of the day.
Thank you.